have the patient block one side, you can try it out yourself. I'm not doing very well today. And actually, you can pick up a lot of things by doing that. Now, we're going to take a new cone, a new otoscope cone, and we'll look at the schnozola. And you can look in one side. Now, you do need to lift the tip of the nose up. Remember I said when we start the exam, I want you in gloves? Because we're touching somebody's head. And here you are close to the schnozola. All I can think is, MRSA, MRSA. You should be thinking that too. It doesn't matter where you are, MRSA. Okay. Now, as we lift the nose up, we're going to inspect the nair. Now, what do we expect? The nair inside has a very beefy red mucosa. That's normal. Nice pinkish red. However, if someone has allergies, they tend to have a very pale pink mucosa, and it tends to be boggy. Now, some of you may have allergies. Does anyone mind sharing if they have, say, allergic rhinitis? Okay, so nobody has it. I was just going to say, oh, we're all going to look up your nose. Never mind. I didn't say that. Okay. But it's good to learn. The anterior septum has an area of blood vessels called Kieselbach's plexus. This is where most nosebleeds come from. And patients will say, oh, you know, there's a scab in my nose, and suddenly I had a nosebleed. It's pretty common. Now, sinuses, we've got frontal sinuses and maxillary sinuses. Great. Now, what the examiner does is she will press them, and I found that if I tap them, I actually can get more complaints of tenderness than just pressing. Because the tapping, if there's fluid inside of the hollow sinus, causes fluid to move, and that can be painful, especially if you have an infection. Now, when we go over to the other side in a little bit of time, I'm going to actually show you how to illuminate the sinuses, and you can actually see that they're clear